Hello, it is Friday again, and you're here with Legacy Changemakers. Welcome, and thank you for joining us. My name is Biana, and I will be your host. And as usual, I want to tell you a little bit about Legacy Changemaker. The mission of Legacy Changemaker is to celebrate, to connect, and to further inspire people who are working towards a more peaceful, prosperous, hopeful, and people and planet centered world. This is what we do every Friday. And yet again, we have another person to celebrate. Her name is Bea. And Bea is going to talk to us about how can we move forward towards a healthy future within the planetary boundaries. But before we dive into the conversation with Bea, let me tell you a little bit about Bea. So Bea is really young. She's a very young activist. And on top of that, she's a medical student. And she has a passion for health equity. She really cares about planetary health and the planetary boundaries. And when she was 22, she was the youngest catalyst supporting the Collaboratio Helvetica. In addition to that, she has co-founded Health for Futures movement in Switzerland. So let's welcome Bea. Hello, Bea.
Hi, it's so nice to be here.
It's so nice to have you. Thank you for joining us.
Well, thank you for having me.
Before we start the conversation, let's talk a little bit about what is planetary health. Can you explain to us?
Well, like the COVID pandemic showed us, our health of human beings is highly interlinked to the health of animals and our ecosystems, because COVID is a zoonotic disease that hopped over from animals to humans. So the ecosystems, our planet, animals, and humans, the health is all interlinked. And this is what we call planetary health. And this health of all of us is only possible within the planetary boundaries. And the planetary boundaries are like the limited resources we have on our planet. And we have one planet. This is our very own home. So we need to stay within those boundaries in order to be healthy, because everything is interlinked and interconnected.
Great, thank you for explaining that. And let me mention something which I forgot, and I think it's really important. What is important to know is that during the COVID-19 pandemic, Bea was a frontline worker, and she was working in the ICU units. And simultaneously, you were also a youth representative at the World Health Assembly, right?
To the WHO, yes.
Yes. So I think this is really important to know. So let's dive in. What is the change that you're bringing about there?
So as you say, as a medical student, for me, my goal is to promote health for all beings on this world. And what we can see is that there are so many people and initiatives promoting health and sustainability, but all these different projects still don't bring the effects we would like to see, right? Because everyone is tackling their own problems. So with Collaboratio Helvetica, the organization I'm a catalyst of for health and climate action, we try to address the root causes of the problems and really bring all these different change makers of the different SDGs, the Sustainable Development Goals, together in order to make systemic change. And I'm also part of the Health for Future movement, as you mentioned. And this is a movement that is using the voice of health professionals to advocate for climate action, climate justice, and as I mentioned, to stay within those planetary boundaries for a healthy future.
Great, great. So can you explain us how is health and climate connected, and why are you doing what you're doing?
Well, when I started studying medicine, I was like, okay, let's learn on how to promote the health of people, and I want to learn everything. And then when I participated at some international conferences, I learned about the Paris Agreement and about the IPCC report. And I learned that The Lancet, the most important medical journal, stated that climate change and the climate crisis is the biggest threat to global health of the 21st century. And I was shocked because I didn't learn about this in university. And I was like, how does this come? So let me quickly explain how climate change is impacting our health. On the one hand, we have more heat waves, more floodings, more droughts, which forces people into migration and impacts their mental health. And already in Switzerland, we are seeing hotter and hotter summers and longer heat waves. And in the emergency departments, we see more people coming in, especially vulnerable people. And we observe more deaths over the past 20 years every year with the hotter summers, and really linked to the heat waves. And another really important point is the infectious diseases, because diseases like malaria can now survive in Switzerland, which means that the animal, the mosquito carrying the disease, can now survive also in the north of the Alps, so where Switzerland is, and because it's getting warmer and warmer, and the changing climate makes that also the tiger mosquito, which is carrying the dengue fever or chikungunya, can now survive in Switzerland. So we are now also in threat of those new emerging infectious diseases. And speaking of diseases, with the ecological crisis, we also see deforestation and factory farming and wildlife trafficking. And those things make that we come in contact with viruses that are yet unknown to humankind, right? Because there are over 40 million viruses, for example, in natural habitats, which are yet untouched. But we as humans, we continue with deforestation at a rising speed. So we come in contact with more and more animals and more viruses. Then also just simple things like allergies. People with allergies will be more affected because the season becomes longer where you have allergies. And also the air pollution is really an important thing, right? Because air pollution kills more or takes more than 8 million lives every year. This is more than tobacco does. And people don't know this. So there are many impacts on our health already now. So the climate crisis is a health emergency today.
And I'm hearing that it is not only a health emergency today, but it's also a health emergency in a prosperous country like Switzerland, isn't it?
Exactly.
Can you tell us a little bit more about that?
Well, as I said, we are already seeing the effects of the heat waves, of the allergy season. So while, of course, the extreme weather events and the droughts mostly affect, like the most vulnerable populations are affected the most, we already measured that here in Switzerland. So also in Switzerland, we need to adapt our health sector, and our health sector, which is like designed to protect the health of people, is actually the fourth biggest contributor to the greenhouse gas emissions of Switzerland. So actually,
really?
Yeah,
Really?
this is crazy. Like the health sector, which should protect the health, actually emits greenhouse gas emissions, and we know that they are harmful for the health of people. So actually, we need to really cut back on emissions in order to stay within those planetary boundaries.
Oh, this is really worrying. So in addition to what you just told me, what are the biggest challenges you're facing?
So as we say, we have the health sector that is not only in Switzerland, but globally contributing to greenhouse gas emissions. Then in Switzerland, explicitly, we have the second most expensive health sector. So we would like to transform this and really address the root causes of this whole system. So we need to cut down emissions, and we need to transform the system to more health promotion and also prevention instead of only curing disease, which also means really transforming the whole system and not forgetting that we can't just like stay at the surface and do little solutions, but this needs a whole transformation, because otherwise a healthy future is not possible. And when we're trying to do this in Switzerland, it's sometimes as a young woman really, really challenging, because the current system is designed like this, that the interests of young people and of women are not taken into consideration. So,
what do you mean by that? Explain us more, please.
Yeah, when we have like decision making, young people and their voices are not included. And for example, women are just generally in the system less considered. Just to give an example, that still over 90% of the leadership positions in the health, of doctors are men, and that female doctors earn 30% less than male doctors do in the same position.
Did I hear correctly? Did you just say that female doctors in Switzerland earn 30% less than male doctors?
Yeah, so you see what kind of system we're navigating in, right?
Yes.
So the system is not designed to take our concerns into consideration. So this is quite a challenge, right, on this system transformation level. And just for me personally, probably when I go to a challenge, I would think back to last year. And because when we were in March 2020 and the whole lockdown was and everyone was staying at home, we as medical students, we were mobilized to help out in all the intensive care units and to help out in the hospitals and to support the health system. So I was working on the intensive care unit and I was doing night shifts and seeing how all these people, like the nurses and doctors, are doing amazing work and giving all their energy and almost working as much that they're getting sick themselves. And then in the same time, I saw that and observed that already on a global scale, people were saying we need to go back to normal. But what is this normal? It's just a self-destructing system, which is like rapidly escalating us into the climate crisis. And to navigate in between this, okay, we are already mobilizing loads of money to save economies like the fossil fuel economy or the airplane sector, and just to mobilizing millions and billions of dollars to support them. And at the same time, I was in the healthcare sector and nothing was changing there. And still now, like in Switzerland, things are opening again, but we don't observe any change in the think of how we put health as a priority. So the health of young people is not put as a priority, or the health of the healthcare workers is not put as a priority. And to navigate within this, okay, we are giving a lot in the healthcare sector, and then what is happening on the global scale, was a huge challenge to navigate in for me.
And how did this land on you?
Sorry, how
did you manage to navigate it? What are the lessons that you learned from it?
The lessons learned for me is that a healthy future is possible. If we put health as a priority, we can change. Because 2 years ago, when the Fridays for Future movement and the climate strike here in Switzerland, when they called upon governments to stop the health harming and environment harming industries, they were no, but it's really, really hard. And then COVID showed us that if you put health as a priority, it's possible, that you can take drastic measures, because a health crisis needs drastic measures, right? There's no way around it. And the climate crisis is a health crisis. So what I learned from the last year is people can be so creative and can really adapt very fast and can create new normals, and that this healthy future and new ways of living together are very possible, but we need the governments and politicians to take this seriously.
I see. So a healthy future is possible. On that note, can you tell us what has been your biggest achievement thus far? You told us about the challenges, but it's also good to touch upon the achievements.
Yeah, to share the positive things. Good question. The biggest achievement, that's big. I will just give something very concrete. So what we did as medical students, we were like, okay, we don't learn about this. It's the biggest health crisis. So why don't we learn about this? Why aren't people talking about this? Why is the government not doing something if this is such a huge crisis? So we got really concerned about this, reading all these international scientific reports. What we did is that we said, okay, we just go to the Swiss Medical Association and demand them to do a strategy and to acknowledge that climate change is a health crisis. So we went like through with all these stakeholders. We managed that now the Swiss Medical Association is developing a strategy on climate change and health, which is like a really concrete thing, because now they're thinking about what can be done in Switzerland. And the strategy is still in progress. I'm part of the working group, and I'm convinced that this is a huge step towards recognizing that the climate crisis is a health crisis, and to bring that also into the politics and the national narrative.
That's great. That's really great. Since when have you been trying to approach the Swiss Medical Association and trying to collaborate with them? Did it take a long time until they jumped on board?
So, as I said, the system is not designed that really our voice is taken into consideration. So we can't just go to them and ask them to do something, but we needed to go via our like mother organization, like the Association for Young Doctors. And since we're really closely collaborating with them, they were like, oh yeah, we'll support your idea, because they know how important it is. So they helped us to write the motion and to bring it in the Swiss Medical Association. And that was, we started at the beginning of last year, then COVID happened, but then we sent it to the Swiss Medical Association. It got accepted in October last year. Now, since October, we're working on the strategy. And October this year, we will vote on this. So fingers crossed that it gets accepted, and that then finally we can really work on tackling the climate crisis as it is.
And just to understand, this is going to be a national strategy for all of Switzerland.
For the doctors. So what
yes.
Doctors can do in order to mobilize the doctors, because of course the Swiss Medical Association can only do something as an association. They don't. They can use the voice of doctors, and that's the most important thing, because studies show that if you look at the different professions and which profession has the most trust of society, then on the right side, like you have politicians and journalists, and people don't trust them, and like bankers, and then you move on, then you have teachers, and then on the very left with the most trust, you have nurses and doctors. So we have a special privilege and responsibility to protect the health of people. So when we talk about pandemic prevention, we really need to use our voice. And this, as we could see so far in Switzerland, wasn't happening, that like the Swiss Medical Association wasn't using their voice, and I really hope they will do in the future.
Amazing work. This warms up my heart. I'm so happy to hear that. On that note, for those who are watching, and unfortunately our LinkedIn broadcast is not working today, I don't know why, but we will be sharing the YouTube link on LinkedIn later. So, but if you are to give them some advice to the future audience, what would you ask them to do?
Well, especially if there are any health professionals listening, I really would advise them to make use of that privilege and the trust we're having. And I know that health professionals are the ones who already give a lot, but our voices are really, really needed in this whole ecological crisis talk. And we need to stand up for the health. And then just in general, for example, when you look at the WHO, they are saying that health in all policies is needed for every country. And health in all policies is an approach where in every political decision, the health impacts are taken into account. So whenever in politics you will take a decision into one or the other direction, you know, how will this impact our health? And not only today directly, but also how will this impact the health in 10 or 20 years, right? So this kind of health and all policies approach we still don't have in Switzerland, and many, many countries still don't have this. So this is what you can do. You can use your voice and ask questions. Ask, how will this impact our health? And will this enable me, my children, my grandchildren, a healthy future? And for example, I ask those questions at the family table. I ask those questions in my classroom, and like at university, in the hospitals, and like whenever I meet friends, and just on every level you can ask questions, right? So you are having an impact every single day, and you can choose what questions you want to ask. And I just go, I'm really concerned about this. What do you think about this? Let's do something. And I think this is what we need to do, is that we really use our bodies and use our voices to speak up and move towards this healthy future.
Yes, I love how you managed to bring such a complex topic down to a very simple call to action. Ask questions, use your voice, use your body. And the question is, how will this impact our health? How is anything that we're doing impacting our health? Mm-hmm. And this really is very well aligned with the concept of turning health into our biggest priority, which you shared with me a while ago. So this is great. Thank you so much. Is there anything else that you would like to add? And of course, if there's anybody who is watching us on YouTube, please, your questions are more than welcome. We are going to see them immediately, and they're going to be answered. So do not hesitate to ask your questions if you're listening to us. So, but while we're waiting, Bea, tell us, is there anything else that you think we've missed in this conversation and you would like to add?
Well, what I really appreciate is that, like, your interest, right, in those topics, because I think that's really important, that we sit together, people from different generations, and dream about how this healthier future could look like, right? I mean, like, this is really something we need to celebrate more, and there are so many things to celebrate. And I was using the word a crisis a lot, but then of course so many good things are possible. And there's this concept of co-health benefits of climate protection and environmental protection. So every time, like, all of the measures we take to protect our climate will have good effects on our health, on our very own health. So just giving concrete example with patients, right? When I talk with patients, and we're talking, for example, about nutrition and the way they eat, and obesity, is one of the leading global risk factors for disease at the moment. There are actually more people dying because they have eaten too much and are obese than of extreme hunger. So this is also something we really need to tackle, the so-called non-communicable diseases. So we need to change the nutrition, and by changing the nutrition to a healthy diet was defined by the Lancet Eat report as the planetary health diet, because it also reduces a lot of animal protein intake and increases the amount of vegetable intake. So this not only benefits your own health, but also the health of the environment. So this is what we call co-health benefit, or just simple things as switching from car to bicycle at work, like when you go to work. This will benefit your health and the health of the environment. And there are many things we can celebrate if we have cleaner air and healthier bodies in this healthy future, right?
Yes, that's right. So it's great. It's really great. So ask, how is what I'm doing, or how is what our politicians are suggesting benefiting our health or influencing our health, right? Eat more vegetables. As simple as that. And less animal protein. This will contribute to your own health as well as to the health of the planet. And take a bicycle. It will contribute to the health of the planet as well as to your own health. This is just so simple. Thank you. Thank you so much, Bea.
Well, I want to go on that, like, because when you share that, of course, it's simple. These are very simple steps for your health. But I think when we talk about our impact, it's really important to not concentrate on your own carbon footprint you're having, but on your political handprint, right? Like what I said with the voice, because we won't, if everyone just tries to do something themselves, won't change the system. So we really need approaches like Collaboratio Helvetica, where you're taking all these different change makers and bringing them together. And this is what we need to do, for example, in the health sector, that we bring together all the different stakeholders to leave no one behind, and to really leave no one behind. And to not only talk about, yeah, now we can turn back to normal, and now we fought the COVID pandemic, and everyone's healthy and sustainability, blah, 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 but really to put health as a priority and to take effective measures and not just talk empty words, what we're observing in many, many places.
That's amazing. I learned so much today. So I'm really impressed with this phrase of do not only care about your footprint, but also care about your handprint, political handprint, right?
Yeah.
Thank you so much. That's amazing. I'm really learning from you, and I'm enjoying it so much. I hope so our future or current viewers. On that note, thank you so much. It has been a real pleasure talking to you.
Well, the pleasure was mine. Thank you so much, Biljana.
You're very welcome. And in case anybody would like to join Collaboratio Helvetica, how can they do that?
Well, Collaboratio Helvetica it's good that you mentioned that, because before we close off, I think that's really important for people also to know. It's a community and a network in Switzerland, and you will find it under, like, also when you Google it, and you will find all information, and it brings together different people who, yeah, you have the link below. That's perfect. We bring together those different change makers and catalysts, as we call it, to catalyze this change, and to bring everyone at the table, and to use new approaches for social innovation and systemic change. And whoever feels called to join, they are doing great different projects, not only of capacity building, but of bringing different stakeholders together and really addressing the 2030 agenda of the Sustainable Development Goals in Switzerland. So if you feel called to also join this and really affect systemic change until 2030 in the next 9 years, to work together for this healthy future within the planetary boundaries, come and join us.
Great, great. So do join Collaboratio Helvetica. Do become a catalyst. Choose the route in which you want to work. Ask, how is this affecting our health? Or is anything you do affecting your health? Take your bicycle, eat veggies, and care about your political
handprint. Move.
That's right.
Yes.
So once again, thank you. It has been a real pleasure. I wish you all the best in your studies, in the work, in the change you're bringing about, and I'm definitely joining Collaboratio Helvetica.
Thank you so much, Biljana, and goodbye.
Goodbye. So, thank you very much. We will see each other next Friday. Have a lovely weekend.